Schizophrenia is a chronic psychological disorder that consists of frightening symptoms which can include hallucinations, delusions, disorganization, impaired cognition, catatonia, and many more. It is one of the most severe, restricting, and emotionally demoralizing illnesses that one can be diagnosed with. It is a cluster of psychotic barriers that collectively hinders the ability to think and respond mentally and emotionally. It is an uncommon but life-changing disorder that affects about only 1% of the population. What is so horrible about being diagnosed with schizophrenia is that it alters and impedes upon an individual's ability to perceive the world around them in the same way that most people do.
Although there are treatments, there is no cure for schizophrenia, and patients have to deal with it for their whole lives from when they are diagnosed, which is commonly in early adulthood. It is extremely difficult to be a part of someone's life who is diagnosed with schizophrenia due to the love and care that the family members have for the patients. Because of these symptoms, relationships between family members and patients are strongly affected and change forever.
Due to the symptoms of schizophrenia, it is difficult for patients to get into the workforce and keep a steady job to provide for themselves and family members. If a patient of schizophrenia has children, it is hard to provide for them and give them the life they deserve. Of the 2 million Americans struggling with this disorder, it is estimated that only about 10 to 27% are in the workforce. This means that those who have children and struggle with these symptoms are unable to work and receive an income so that they can afford everyday items for their children. This creates a blockade in a good relationship between a parent and their child. A child living with a parent who cannot provide for them develops mistrust between the two and a sense of hostility. The child can feel as if their parent is not doing what they should be doing for them, especially as they grow with age. They will feel that they cannot look to their parent for the normal daily things that most children are able to do.
Because of this inability, children usually begin to distance themselves from their parent, and they do not build the typical parent-child relationship that most do. Due to the excessive help and support that patients of schizophrenia are in need of, relatives display an extreme increase in self-sacrificing behaviors.
In 2004, there was a study conducted by Gumber and Misra that consisted of 15 schizophrenic patients and 15 family members. In this study, it was discovered that 40% of relatives displayed overprotective or self-sacrificing behaviors, taking extra steps and responsibility to ensure patients' well-being, health, and development, allowing the patient's wishes and desires to be met before their own because they feel that the patient needs to be content with their life before moving on with their own and thinking about their own well-being. This self-sacrificing behavior is extremely similar to the behavior of my grandmother, whose daughter or my aunt has been diagnosed with schizophrenia for the past 30 years. My grandmother has been extremely overprotective over my aunt since I have been alive. It seems as if she has forgotten about her own well-being and those around her, including her other children or grandchildren like myself. My grandmother is in her 90s and struggles to care for herself. However, with my aunt having recurring episodes every now and then, she cares more for her than she does for herself.
A main area of schizophrenia in relationships with family members is expressed emotion. Expressed emotion is defined as a measure of hostile, critical, or overly involved parental attitudes toward the patient.
Within families that have a schizophrenic patient, there are extremely high levels of expressed emotion due to the hectic life that a relative must live in order to help a loved one. In the same study conducted by Gumber and Misra, it was concluded that high levels of expressed emotion that was displayed in the study revealed that they were experiencing a high amount of stress. From their conclusion, they were able to infer that the high levels of expressed emotion in families with a schizophrenic patient derive from the burden involved in caring for the patients. The symptoms of schizophrenia are not only difficult to deal with as a patient, but very difficult for a family member as well. Family members are forced to watch their relatives struggle with this horrifying disorder that comes with such disturbing symptoms. Watching a patient whom one cares about go through such a hard time puts an extreme amount of guilt on the relative, which leads to forced support, leading to extreme amount of stress, which finally leads to expressed emotion and hostility toward the patient or the situation. The mental illness of schizophrenia changes both the patient's lives and the relatives of the patient as well. Family members are afraid and confused by the patient's beliefs, actions, and words. As the patient struggles with the symptoms of their illness, family members are commonly by their side struggling as well as their relationship changes between the two.
Schizophrenia in households causes many different emotions and events that interfere with the ideal relationship of family members. Due to schizophrenia, the relationship between a patient and their relatives change forever.
The severity of this illness has a tremendous effect on all aspects of life, resulting in the disturbance of everyday functioning of an individual. A significant amount of detriment on one's ability to live everyday life, such as vocational activities, educational performance, independent living skills, and activities of daily life can be attributed to the wide array of disabilities associated with the psychotic illnesses can be observed. These impediments in an individual's ability to exhibit an acceptable capacity for social functioning only adds to the burden of the disability. Schizophrenia is expressed in so-called positive and negative symptoms, the positive symptoms being hallucinations and delusions, and the negative symptoms being decreased attention and reduced speech. When schizophrenia is active, it can result in hallucinations, delusions, impaired understanding and focus, and a decrease in motivation. These hallucinations and delusions convey falsifications in the perception and understanding of reality. One of the most prevalent kind of impairment caused by schizophrenia involves the thought process of the affected person. An individual's ability to rationally evaluate his or her surroundings and interactions with others can be significantly decreased by schizophrenia. A chronic brain disorder like schizophrenia alters thinking, feeling, understanding, and consciousness in self in affected persons. The resulting behavior may appear to be bizarre to the casual observer, even though in the reality of those affected, their concept of what is happening may be consistent with the individual's perceptions and belief. The abnormalities observed are not necessarily something those individuals affected choose to convey for the sake of being different. Rather, what they are portraying is something that in their own minds is normal.
With all the hardships that come along with schizophrenia, it becomes difficult for those to go about their normal daily routines, which overall has a great impact on the quality of life. In an article written by Raj, she discusses how the problems relating to self-care and personal space ultimately affect their social involvement. She explains that schizophrenia disturbs the character of an individual, negatively impacting their quality of life as it rips the person out of their functioning in various areas of life.
Their interaction and involvement with family and friends deteriorates and at most times stops altogether. Not only does schizophrenia affect life at home, but it can also result in the failure to excel in school, as individuals are no longer willing to participate in activities they once enjoyed. As the performance of individuals suffering from schizophrenia continually decreases, their quality of life essentially becomes an empty perception. However, work helps boost the satisfaction and confidence levels in those living with schizophrenia. A paying job can be a catalyst for affected individuals as they attempt to grow and become fiscally independent. The experiences with schizophrenia will be different among the individuals who have it. The severity regarding the day-to-day adversity caused by the disability may differ in individuals with schizophrenia. Some may be highly functioning in certain areas, others may be capable of maintaining a minimum level of functioning with or without support. In a small amount of cases, an individual may need constant support to carry out even small activities. Raj explains that the individuals that live with schizophrenia, their day begins with reminders and pressures to perform activities of daily life. It takes a long time to get into the habit of developing a routine and follow it without failure. To conclude her article, Raj contests that the hardship that arises from the effects of schizophrenia without a doubt have severe implications on various factions of day-to-day life.
Managing medication is an important part of staying well for those living with schizophrenia. However, managing and organizing medication is not something that comes easy for those who are living with schizophrenia, which can be dangerous when it is something needed for a successful recovery.
Although medication is supposed to help with one's recovery, taking a new medication can sometimes cause unfamiliar side effects. Similar to all other aspects of living with schizophrenia, medication must be actively managed and controlled if it is to be a successful means of coping with the side effects of the disease. The side effects from the antipsychotic drugs include uncontrollable movements. Fortunately, there are ways to cope with these side effects, such as taking the right medication. Another way to deal with these side effects is to discuss with the doctor about lowering the dosage of the medication for a trial period to see if it is possible to essentially reduce the side effects without having the symptoms of schizophrenia return. It's difficult to make changes to adjust with an entirely new lifestyle onset by the diagnosis of schizophrenia. One's daily routine changes drastically, making it harder to go about day-to-day life. Schizophrenia hinders one's ability to understand and perceive the world around them, making it extremely frustrating to do normal things such as focusing in school and even tasks as simple as taking care of chores around the house. The detrimental impact on an individual's quality of life and daily routines stems from the hardships and disability induced by the disease. However, a successful road to recovery is possible when you handle this disorder in the right manner. Managing medication, setting tasks, and talking to your doctor can greatly improve the symptoms that come along with schizophrenia.